You're listening to There's a Lesson in Here Somewhere, a podcast featuring compelling conversations with exceptional people. Whether it's an inspirational achievement, a hardship overcome, or simply a unique perspective, these are stories we can all learn from. Here are your hosts, Jamie Serino and Carlos Arcila.
Hello and welcome to There's a Lesson in Here Somewhere. I'm Jamie Serino, and we're here today with Lisa Ellis Gavin, a clinical mental health and substance use clinician in New Jersey, and a clinical specialist in the Department of Counseling at Montclair State University. Lisa, welcome.
Hey, Jamie. Thanks for having me.
Yeah, thanks for joining us.
Yeah.
So could you provide a little bit of a bigger introduction for yourself and go into your background and all the amazing things that you've done?
Sure. So my name is Lisa Gavin, or Lisa Ellis Gavin. I am a licensed professional counselor and a licensed clinical alcohol and drug counselor in the state of New Jersey. And I also am an improved clinical supervisor. I currently work at Montclair State University as a clinical specialist overseeing 4 of our counseling certificate programs. I also am a owner of a small virtual private practice in the state of New Jersey, where I work with adults who are struggling with anxiety or trauma or that are in early recovery. So that's a little bit about what I do now. Background is I graduated from the same program I currently work in. I have a master's in counseling, specifically in addiction counseling. A lot of my background has been in the substance use realm. So I've worked in various levels of care, from typical detox, or what was formerly known as detox, to an inpatient short-term residential program, to intensive outpatient programs, primarily in the urban environment, specifically Paterson, New Jersey. I primarily worked with folks that were struggling with both substance use and mental health disorders. So what we refer to as co-occurring disorders, or legally mandated or involved clients. So a lot of my background is in that. And more recently, I've been getting into eye movement, desensitization and reprocessing, to help folks heal from traumatic events in their lives. So that's...
Yeah, I definitely would love to talk a little bit about EMDR. But to rewind a little bit, just for people listening or watching, when we talk about counseling, that means like therapy, basically, right? Yep. So the world kind of calls it therapy, therapist, but really it's counseling, right?
Yeah.
So if you want to talk a little bit about that, that would be interesting. But also, I think it would be good to talk about how the sort of terminology has shifted away from addiction and that person is an addict to other types of phrases that are now used. I wonder if you can maybe start there.
Yeah. So I guess just even when we think of the evolution of the field, right back in years and years and way before my time, the historic treatment of a quote unquote addict was an addict helps an addict, and that's the only way that they can get better, or a complete abstinence model. Can't use drugs. We need to break you down to build you up. Very kind of tough love, if you will. And the language being used is you're always an addict, right?
Mm.
And kind of labeling folks and keeping them in that box. So thankfully, the field has evolved and we're learning more and doing more research and understanding, but really approaching clients and people who are struggling with substance use through a more holistic wellness model lens, but also thinking about the language that we're using with folks. So since the history of counseling, or specifically substance use counseling, we've seen it evolve to have more credentialing, more research, a national organization letters, being licensed in it, and really starting to move towards how do we help folks be successful in their ideal life, and kind of taking where we're not saying you just need to stop using drugs and that's the solution, but looking at the person as a whole. So thinking, do they have what's going on mentally, emotionally, physically, socially, within their family, thinking about their education background and their substance use currently, and seeing how do we address all of these at once, and also thinking about a person as a person. So they're not just a quote unquote addict, but they're a person who is struggling right now with a substance use concern.
Mm.
So really starting to shift our language into a more person-centered or strength-based approach, as opposed to the historic put you down, make you feel less than language that we used to use.
Yeah, and so as you were talking, I was remembering a scene from Mad Men, and not to make light of this, but this guy, he gets too drunk and misses a meeting and falls asleep on the couch in his office, and so they decide, all right, we need to send him, to some sort of program, and these two guys sit down with him to talk to him about that. And they're like, we're gonna let you go, and you're gonna go to this program, then you're gonna come back. And he's like, okay. And then they go to him, all right, now let's go out and get a drink. Right? So that, scene takes place in the 50s or 60s. So that just popped into my mind. But what are some of the things do you think, and there are many, but what comes to mind, the causes for the changes that have happened, these positive changes toward how can we help this person get through this, or how can we help them understand better why they have a substance use issue, and how can we help them get through it? You've talked a lot about the biology behind it, and we seem to have a better understanding of that. There's you talked about a strength-based approach, person-centered approach. What comes to mind when you think about, well, we are here today now, and it's different from decades ago? What are some of the things that you think brought us here?
Yeah, so I think there's more acceptance, and that it's not a hidden secret. So I
Mm,
think, right, you bring up Mad Men, that was based in like the 1950s, 1960s, and thinking even just as mental health in general,
hmm
it's always been this hush hush type of shame or scarlet letter, if you will, um, and that folks would just kind of wish it away, or if we don't talk about it, then it doesn't exist.
hmm
And however, there has been a pretty noticeable shift, and we've seen it since the 90s in terms of just the opiate epidemic, right? So that's kind of been the thing to push substance use and substance use disorders and substance use treatment really evolving more quickly and becoming more um, trying to think of the word, but becoming more acceptable, or
hmm
seeking help becoming more acceptable,
Right.
because people are willing to talk about it because it's affecting more people. It can't be
hmm
this like, oh, there's all of these people dying, but we're not talking about it,
Right.
right? And so with the opiate epidemic, while unfortunately we've lost so many people, and especially young folks, um, it did shed light on the fact that, hey, something's going on that's really affecting our youth, affecting our communities, our society as a whole, and what can we do to help or fix that? And I think social media, the ability to speak on this, more platforms of this, also the funding from just not even small funding sources, but national funding sources, to get more credentialed clinicians, be it social workers, counselors, psychologists, having more training in substance use counseling, and having more accessibility for people to seek help.
Mm.
So I think really we started seeing this evolution because of opiates affecting such a massive amount of folks,
Yeah.
and it still does to this day. And we're seeing that that it came from opioids and heroin to now we're seeing a lot of the overdose deaths being due to fentanyl.
Yeah, yeah. Well, so uh, going back a little bit, I think the narrative there you're talking about, because I think part of the narrative of the opioid epidemic is one of like the person almost being victimized by it. That, oh, I only had back pain and I tried to take this drug and then I got addicted to it. It wasn't my fault. Right. And that's different from the way people perceived people during, let's say, the crack epidemic. Right. The crack epidemic was those people are criminals. They're doing it to themselves. They sort of, we shouldn't help them. Right. So I wonder if you could talk a little bit about that. Like, there's a big difference between what happened in the 80s and then what happened in the 90s. And of course, the different populations there, people of color, socioeconomic status, and then, white people, maybe middle class. There's a lot there. It opens up a huge can of worms, I'm sure, but it's part of it.
Yeah, I mean, so you think about the war on drugs being kickstarted in the 80s and the famous, there was a bag of crack
Okay.
cocaine found outside of the White House, and
Right.
the Just Say No campaign and all of this stuff. And it really was based in a systematic racism and, again, kind of pitting people and things away from each other. So it was, how do we you continue to oppress certain people and certain groups and um, keep our jails or our courts or our probation working. So how do we continue this law and order or this law and punishment model?
Yeah.
And back in 2013, 2010-ish is when we started hearing more about the opiate epidemic and needing to do something to address this. And that's when we really started seeing more white folks being affected by the opiates. And so then it became
Mhm.
this up in arms of white children are dying. So now we need to do something. And
Yeah.
so there's a very stark difference in terms of how we societally and even through the government or through means have addressed these epidemics, the 80s and the crack epidemic and the war on drugs versus how we're approaching it now in this more unloving, compassionate way. And there definitely is an underlying feel of um, that, the war on drugs didn't solve the problem,
Yeah.
right? Like it's like Just Say No, or if we can arrest and um, throw people away or put them in jails, that will solve the problem, and it's still happening.
Right. Right. Um, Going back to fentanyl, could you talk a little bit more about that and about, its sort of how it came onto the scene and the dangers there and what you're seeing now with that and maybe some advice or warnings.
Yeah, so fentanyl has been around for quite some time. Historically, it's been used as within the medical field for treating pain, specifically thinking about terminal ill clients, people who are dealing with like severe terminal cancer,
Yeah.
etc. However, what we people started to realize is that it, because it's under the opioid umbrella, that it produces a really good high, right? People do drugs because they like getting high. But so what they found is that a small piece of fentanyl or a small dose of fentanyl can produce a similar high to heroin. So it's cheap to make and manufacture fentanyl comparative to heroin, and people can experience the effect that they were looking for. So we're starting to see that heroin was being cut with fentanyl because it made that people were getting that high that they were seeking or searching for, and that you were going to try and get repeat customers.
Yeah.
Right? Like as a drug dealer, you want people to come get your supply. And so if you're cutting with fentanyl, people are going, oh, that's the good stuff.
Right.
I'm not trying to like make that enticing for others, but this is kind of the thought process.
Yeah.
And so when people hear on the street, oh, this stamp or this specific dose, or I can't think of the word, but this specific batch, of heroin, or this stamp is causing people to overdose, people are going to run towards it because that means that they're getting really high. They're getting that euphoria that they're looking for, and that they can handle it. And so what ends up happening is that people think that they can use fentanyl, that that they know what they're doing, or they know how much they're supposed to use. But ultimately, fentanyl, a small amount, can trigger an overdose. And an overdose, the theory behind overdoses is that it stops your central nervous system. So your brain receptors aren't receiving the message to breathe, right? Or to have your heart. So eventually it just becomes that you stop breathing, and eventually that's how someone passes away from an overdose. And so it takes a smaller amount of fentanyl to get that effect comparative to heroin. And so it's cheaper to make. It produces this effect that people are seeking. And so people are going to continue to go towards that substance or want to use that substance. And we're experiencing that uptick. About 2016 is when we saw the highest rate, or really that's when the opiate epidemic was considered a public epidemic, or was established as an epidemic, or a national epidemic. And so the smaller amount of fentanyl is what produces the better high, which then ultimately can put people at risk of overdosing. The other thing is that because of how cheap it is to manufacture and cut into other drugs, it is now becoming seen in other drugs. So people have it cut in their Coke, or mixed in their crack cocaine, might be laced in cannabis, street cannabis, can be seen in pills of Molly, ketamine, anything that's being sold on the street. It might be being cut with fentanyl because it's cheap and it produces a high that people are looking for.
So you touched a little bit on, like, some biological components there, of overdose. I wonder if you could talk a little bit about, the biology of, substance abuse, and, sort of chasing a high, getting addicted to something, dopamine activation. I wonder if you could talk a little bit about what's happening in the brain.
Yeah. So substance use is, so when we think about it, we think of it, or we can theorize it as the disease of addiction. And so we have shown, or there is evidence that the brain actually changes certain brain patterns, brain structures start lighting up depending on the substance. And so you can see actual MRI or CAT scans of a brain before drugs, using drugs, after drugs. So there's an actual change in the brain. People don't actively go out and grow up and say, I want to use drugs, or I want to become addicted to drugs, right? Certain things, maybe through experimenting with friends, or maybe getting an injury, being prescribed a painkiller because they had their ACL torn, or wisdom teeth removed, or broke a bone. So then it becomes, this makes me feel good, this gets rid of my pain, and all of the things that were bothering me before don't exist when I'm under the influence. Or there might be I need to celebrate something. So why don't I go celebrate with this or that? Or I want to stay up all night. You think of even alcohol. Historically, it's if you're celebrating something, someone might say, okay, I'll go buy champagne or I'll bring the wine. Oh, you're having a really bad day? I'll go get you a six pack, right? So substance use has been opiates, coke, weed, alcohol have all been used to either get rid of certain feelings or enhance certain feelings. And ultimately, what that does is it reinforces this effect that you're looking for. If you're saying, I want to have a good time, and you're using a substance and it produces more of that euphoria, that good time feeling, and you have all these fun memories, right? You're going to go, oh, this is going to do the same thing. So if I don't want to feel sad or mad or whatever, I can use this and it'll make me feel happy. Or if I'm feeling really down or anxious or just, low and overwhelmed or stressed out by something, and I know taking a pill is going to alleviate that feeling and just let me feel relaxed or chilled out, that's going to reinforce that use where I'm going to seek maybe a Xanax or a pill of some sort to alleviate that feeling of anxiety. And so substance use ultimately can be considered kind of a learned behavior at times, where we're learning, if I don't like these feelings, I can get rid of them really quickly through this substance.
So then in the brain, then what's happening there? So you're talking about, pushing a button, so to speak, a sort of faster arrival at some sort of point that you're trying to reach, as opposed to if I was to go do something else to release dopamine or whatever, neurotransmitter, it might take longer. I might have to work more at it. And a substance is more like, well, I can just take that, drink that, and have that effect.
Yeah. So ultimately, if you think about, for example, I'll just use like Molly, MDMA, or ecstasy, you'll hear people say you get flooded with serotonin, right? And so if you're feeling down and you don't want to feel that way, you want to flood your brain with positive, good feeling neurotransmitters and brain chemicals. So you're going to say, okay, if someone's using Molly, they might say, I'm going to use this because I know it'll flood me with serotonin and I'll have a great time and I'll feel happy and connected to people and everything is just brighter and livelier. And so they're going to learn that is something that produces that effect. And ultimately their brain is learning that behavior as well. So similar to any substance, our neurotransmitters are creating those pathways. And in order for them to reach that same feeling, they might need the help of a substance, right? If that makes sense.
Yeah. So you're talking about like underlying feelings. And so in your experience, do you find that most people that develop a substance use disorder, do they have also depression or anxiety? Or we've also read about the correlation to trauma, experiences of trauma and things like that.
Yeah. So what we do know through just research and data is that people who have a substance use disorder are more likely to struggle with a mental health disorder as well. But as humans, I think we all experience feelings of anxiety and sadness, uncomfortability, stress. And so it's not to say that it's a mental health disorder means that you're going to develop a substance use disorder or vice versa, but that people who use substances eventually don't like feeling sad or anxious. I don't think any of us do, but
Mm,
it's also how are we learning to manage those feelings, right? Someone who might have a supportive, healthy environment or uh, different hobbies, different protective factors. If they're feeling anxious, might be able to go, okay, I know that drinking might make me feel good, but that ultimately isn't going to solve my problem. I want to reach out to a friend, or I want to draw or write or watch a movie or go for a walk or do a mindfulness meditation. All of these things where maybe that is more natural for them to do. And for folks that might be really struggling with how to manage that distressing feeling, they're saying, I need to get rid of this as quick as possible because talking to someone right away is not going to get rid of this feeling.
mm. So it leads me to, you hear about, kids today or the younger generation socializing less, or they're socializing online.
Mm-hmm.
Um, and that might be different. Does that put them more at risk for developing, a substance use disorder? They are communicating with each other, but it's, through their phone or it's through social media. And this is just like what I'm hearing and reading, they're getting together less. And in your, practice in looking at younger people, are you seeing any impact of that type of behavior on, any detrimental impact there?
Um, so I think that we're seeing that, and we really saw it during COVID, right?
Yeah.
Even just as adults too, and that feeling
Yeah.
of isolation. So, um, you know, alcohol use disorders increased during COVID. Liquor stores were considered essential,
Right.
so they were able to stay open
Right.
throughout the epidemic, and uh, so people were like, it's what do we do, right? That isolation can breed um substance use disorders or mental health disorders, right? Like when we're alone, we can get lost in our thoughts, we can feel really disconnected.
Mm,
We're seeing all the things on social media, seeing people post what they want to post, right? Hearing all the scary news going on. So there is that sense of, yes, being connected on social media or to our screens too much can produce a feeling of loneliness and isolation. For some, it was really great for them, and they did feel more connected socially, because it was a way of staying connected to other people.
right.
While I think as humans, we just like being around people and each other. And so um, we did see the uptick of mental health distress, substance use disorders when we were, for, I guess, told to kind of stay away from each other.
Right.
Yeah.
Um, so how about like availability, right? Now that we're seeing, cannabis getting legalized, um, are you seeing any sort of, rise in people like abusing cannabis, or do you? There's a lot of good in it being legalized and available. Are there any consequences that you think that we'll start to see?
Um, that's a really good question. So I think that cannabis has a place in the world in terms of um, thinking it through a harm reduction lens, in terms of, if someone's struggling with an opiate use disorder, could cannabis help in terms of their recovery and be more of what they can use to manage some of their cravings and urges. Yeah. I think that the legalization is wonderful in terms of thinking it through a criminal justice lens, in terms of it alleviates undue, unneeded
Yeah.
pressure or stress on the criminal justice system in terms of people getting arrested for a bag of weed, like
Right.
it's 2024, right? And
Right.
that there's bigger fish to fry out
Right.
there in a sense,
Right.
and that we're also seeing that the federal government is relooking at rescheduling THC. We're seeing that it can be beneficial for medical pain, for certain mental health
Yeah.
disorders. So there is a lot of good in weed. Um, I always go to, and this is just also from my substance use lens, is what's the purpose of the use behind it, right?
Mm-hmm.
So is it being used as a way to escape real life, or is it a way to disconnect yourself or not manage or cope with certain feelings? Then maybe it's not being used in the most appropriate or healthy way,
Mm.
right? So it's one thing if people are using it recreationally because they're with friends, etc. But are you now becoming, I need it in order to manage or deal with X, Y, and Z, and the intention behind it is so that I'm disconnected from reality, then maybe there might be some cause for concern.
Yeah. My dog uses it. So
It didn't
uh,
work for my dog. I
it
got his
didn't.
THC and it did not work, but yes.
Well, we have to be careful with the THC with him,
Yeah.
but the CBD helps him. He has arthritis. He's
Sure.
13. He's a great dog, and he has arthritis like in his hips, and
Yeah.
and it helps him. It really it's worked wonders for him.
Yeah. I mean, it can be helpful for cancer patients who are dealing with nausea
Yeah.
from chemo. It can be helpful for arthritis. It can be helpful for PTSD symptoms in terms of
Mm.
just been difficulty falling asleep. It could be helpful for a mirage of things, but it's also, am I using this for the intended purposes, or is this a way for me to disconnect from others? And I think really a lot of it stems from um, what's the intention behind this? And is it
Yeah.
having a more negative impact in my life, or is it helpful?
Right. And so maybe there's some advice there if you could give it to like someone that maybe is seeing someone start to abuse a substance, especially a parent seeing their child or discovering that, or you seeing a friend or anyone really. And I think going back to what we were talking about earlier, this isolation. And so sometimes it helps just check in on somebody, talk to them and see how they're doing. And offer to go hang out or something. But how about a parent that is starting to see their child like, oh, well, I kind of knew they were, doing something, but now it kind of looks like it's sliding. It's something bad. Do you have any advice for that parent?
Uh, yeah, my first initial is like, don't freak out.
Right. that could be a
I
great
mean,
start.
in like a kind of way of, right, if you walk into something and you have like big visceral emotions, they can be like absorbed, and then people start like it causes more chaos, right? And what we want to do is approach this in a way of like calm understanding. And so I think a lot of times as parents, we have to go in and have strong boundaries and rules and expectations, and that um, our feelings too can get involved in this. And so everything feels much bigger. Um, so for parents, it's kind of approaching it in a non-judgmental, supportive concerns way, as opposed to you doing wrong and I'm going to punish you way.
Right.
And I think that goes with anything, in terms of, even if a child was struggling with mental health or feelings of anxiety, you're not going to yell at them or come
Right.
at them in a punishable or like Law and Order type way. I think as a parent, you want to go in with love and compassion and understanding for your child. And
Yeah.
part of it is also removing some of our emotion from it, because when we can have emotion, it can become really overwhelming to manage or ask about. So I would say it's really just talking to your kid with just like a curiosity in a non-judgmental, like, not the like, if you tell me I won't be upset, and then you're like seething on the inside, but kind of like,
Right.
I just want to help, I want to understand you, or
Yeah.
I'm coming from a place of love and concern.
Yeah. Yeah. It definitely can be stressful. And like you're saying, there's emotion tied up in there. And sometimes these stories are kind of sad. Like, oh, my child was this and that, and they did this and that, and now they're doing that. And I don't know how to get them to stop. And so I think the advice there at first, trying to come from a place of understanding and compassion, and the shame and the guilt, doesn't work. And thinking of it also like, would you be angry with them if they were depressed or they had, anxiety, or let's say like an eating disorder or something like that. Like,
Yeah.
you know,
It doesn't mean that it's not scary, right? So
yeah,
we don't want to devalue that, or seem like, oh, you shouldn't have any feeling and you need to go in as a robot. But it's also thinking about how, if we were a doctor, we wouldn't want a doctor having intense emotions during a major surgery on their patient, right? And I'm not saying that you that's the way we should approach for our children, right? I think you can't separate yourself from your child in terms of your emotion, but it's almost like, how do you just say for the second, like, can I put my emotions on a shelf to just be with my child and accept whatever answer they're going to give me, or give them the space to have this open conversation without fear?
hmm yeah. And I think that the like with having that approach where the child feels like they could communicate. I think obviously you're talking about this perfect situation, but
Yeah.
that would be the goal there. And I guess what one more question in this area,
Mhm.
like we were all kids and we experimented with different things, and maybe we knew someone that developed an issue, and we knew other people that didn't, and what's because a parent would know, all right, my child probably is going to experiment with this or with that, and what is a healthy amount. And I know there's no like real answer there, but you know and any advice for a parent of like, well, when do I need to like step in here? How much rope do I give my child? How much is an okay amount of experimentation? It's kind of a wishy-washy question there, but I wonder if you have anything to
Yeah.
say.
I think that's really individualized to the parent and their comfortability. I think not that any parent wants their child using any type of substance, but I think
Right.
it's, how do you engage your kid in non-substance using behaviors or connections? So also, how are you modeling this? So kids also learn from their parents. So if there's alcohol around all the time,
Yeah.
and you know the parent is drinking at every meal, a child's going to see that as a normal, acceptable behavior. If a parent is smoking weed in front of their kid, their child is going to say this is a normal, acceptable behavior.
Yeah.
And so I think it's a matter of individual for the family, what's appropriate for them, getting them involved in things that are non substance related, staying connected, right? We also see that prevention interventions are really helpful in terms of just, being connected to extracurricular activities, having the education to make informed decisions.
Hmm.
Instead of saying, no, you can't do that, and that's the end of the conversation, explaining and giving the education as to why.
Yeah.
Um, for example, and I know this isn't a parent to child, but I remember I had a friend who told me that he liked to drink and use Xanax at the same time. And I was like, oh, that's not a really great combo. And I explained to him what happens in terms of that they're both downers and that 1 + 1 doesn't equal 2 in this, that it actually like equals 100, and that you're that ultimately two downers can really depress your central nervous system to the point where your heart rate becomes very slow or breathing becomes slow, and it's just a dangerous combo. And I remember, I had this as like an off cuff kind of conversation with him. And like a year later, when I saw him, he was like, after that conversation, it really changed my perspective. And so I stopped drinking and using Xanax at the same time. He was like,
Mm.
so I would choose one or the other. And just even giving someone the ability to have the education to make an informed decision can be
Yep.
really empowering. And I think even that comes with the prevention with kids. We don't want to pretend like things don't exist, but
Right.
we want to have them engaged in things that are non-substance related, have them connected to family, friends, loved ones, but also talk about it in the sense of you might see friends that are doing things, and here's what that means, and here's some education about these things. I'm not saying go out and do them, but if you decide you're going to try, maybe have a conversation with me, or how can we talk about this or work through it to see, hey, is this a good decision for me?
Yeah. No, that's great. Um, Shifting back to something you said earlier about EMDR, eye movement desensitization and reprocessing.
Hmm.
Could you talk a little bit more about that? And there would be some people, I think, watching or listening that don't know what that is, and maybe you can, you know, describe it a little bit, and then talk about its use in substance abuse and substance use disorder.
Yeah. So EMDR, eye movement desensitization and reprocessing, has is a treatment modality that has been endorsed by the WHO and the VA in treating post-traumatic stress disorder. So it's a modality in which the clinician has the client do eye movements. So kind of with fingers or a light bar. We could do it with sounds or tapping. Um, and what it does is, and I know I'm going to mess this up, and so I like apologize to my trainers at the EMDR Institute, and but ultimately it allows our brain to have more of an adaptive opening of sorts. I'm like trying to make this in the most digestible way possible, but it allows your brain to kind of move the past that's been sitting in your present, to move that completely into the past. Um,
I I,
what,
I I think that's a. I'm sorry to interrupt, but I think that's a really interesting way of looking at it. Um, and to add to that, I feel like, so the desensitization part is that, if a person thinks about desensitizing themselves to something, if you keep thinking and thinking and thinking about something, you might end up desensitizing yourself to it, or using a behavior to do that. And to me, it's an incredible treatment, because I feel like it just speeds up that process, a
yeah.
process that normally takes a very long time.
Mm-hmm.
This makes your brain do it much faster, because I've done EMDR, and I know it works, and I know that feeling of starting to go down the path of the thought, and then not finding the path, really is one way to describe it. And then the positive thought comes in, and then I move on. That's like one way to describe it. So it's like, you know, maybe I'm starting to go down that path, but it's just not a strong opening anymore as it was. And then the positive path, so the reprocessing, um, that path then is open, and I go down that path,
Mm-hmm.
and then I'm out.
Yeah.
And it's so fast. It's like I start to think it, and then I go the positive thought, and I'm out like seconds. You
Yeah,
know?
and so it's great that, and I appreciate you sharing your experience, Jamie, because it sounds as though EMDR was really helpful for you. And so there are clients that EMDR just works and clicks with, and like there's some clients that are like boom, 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 and
Yep.
we're good. And that's not to say that EMDR is for everyone. So
Yep.
it really depends on the clinician, the client, what they're working on, the openness to EMDR expectations, right? Um, and so there's, I wouldn't say like everyone, I mean, obviously I'm a fan of it. So I'm like, everyone should give it a try.
Yeah.
If you
Yeah.
think this, but also don't be frustrated if it isn't what you're expecting or
Yeah.
as successful, because sometimes EMDR just might not be the modality that works for you.
Yeah.
And that's okay. And there's so many other, thankfully, so many other modalities out there that it's really about what works for you as an individual, and what makes sense, and
Yeah.
what your needs are.
Yeah. I think that's an important point, because there is a whole like sort of evaluation process beforehand, and you know, so that helps to know, you know, could you be open to this type of therapy and stuff. And so that's an important point. When
Yeah.
it works, it works, and then it might not work for everybody.
Yeah, and it's not to say that there aren't things that are beneficial and helpful for folks. And I think it's also, with a good clinician, and I would never with a client be like, okay, we're going to start EMDR. Like that doesn't, you shouldn't
Right.
do that, right? There's a
Right.
lot of like building of a therapeutic relationship
Yeah.
and
Trust
therapeutic
and
rapport and
yeah.
alliance, and really a safety and supportive environment, right? Especially if
Yeah.
we're dealing with some bigger traumas. But also some folks just don't aren't interested in it, or it might not be the best modality for them, and they might be more body based, and so that might be a different approach. Some people need more like black and white, like CBT, like let's map this out, right? Kind of. Some might need a blend of the sorts and have more of a dialectical behavioral therapy approach. So I think it really is dependent on the person. And thankfully, therapy is a not one size fits all, and that's the only way to go. And that um, the most important part of therapy is making sure that you have a clinician, a therapist, a counselor, whatever you want to call them, be a safe, supportive person, and one that you hold trust in
Yeah.
or have a trusting relationship with.
Yeah, that's well said. You said some people are body based. So what would that mean?
So EMDR kind of takes into some of this in terms of like being aware of like a body scan and where you're feeling your feelings. But if you were to do more somatic experience modality, that really focuses on what's going on in your body in the present moment, and kind of I guess that like more mindfulness, Buddha, Eastern flair, of just really working through the body sensations,
Okay.
and identifying where our feelings lie within our body and working through them. I don't know a ton about that modality, and it's something that I don't have expertise or know too much about, but that's like the little bit I know.
Okay. It's interesting. So what are some of the things that you find to be most helpful, and realizing that everyone is going to be different, but what do you, is there a certain type of therapy or a certain approach that you feel like works on most people, or is a general kind of umbrella?
So I don't know if there's the right answer to that, or like a definitive data supported answer.
Hmm.
we're all human and individual. So what works for you might not work for me, and what works for the person down the block might work for another person down the block, but not. So we're all different. And I think we all have different expectations and concerns that we want to address, and what we feel comfortable in, that why we seek therapy, what we're looking to get out of therapy. Right, there's people that might be, I just need a place to vent. There's people that want to work on more deep-seated like internal self-awareness issues. There might be people that are really open to, really ripping back their psyches in a sense, and like doing a deep dive. So, or there's people that are just doing it to say that they did it because that's required by probation, right? Like,
Right. Right.
so everyone has a different reason for engaging in therapy, be it substance use or mental health. What works best, I think, is just, and this is my maybe personal opinion, so it's not facts, it's mine. My thoughts is just treating people as humans, um, and that we are not just a label. And it gets, that goes back to an earlier question in terms of even just the word addict and the evolution of the field, and um, really thinking about, and when we work with clients, thinking about them as a person and who they are as themselves and as this individual, and accepting them as they are,
Mm.
and not defining them by their quote unquote diagnosis or substance that they use or mental health concern, right? Um, so I think the best maybe therapy is one in which you accept your client, or clients are accepted as who they are.
Hmm. Okay, so there are some people that would just be like, okay, so let's say they have an alcohol use issue, and they may not think to go see a counselor. They're just going to be like, I'm going to stop and I'm going to go to AA, right?
Mm-hmm.
So I wonder if you could talk a little bit about, group therapy, AA, or NA, Narcotics Anonymous, because those are all still thriving. And I
Mm-hmm.
wonder if you could talk a little bit about that as like a path. And maybe a person does go see a counselor, but also goes to AA or NA or
Yeah.
something like that. Um, but there are people that I've known from the past that that's how they just dealt with it.
Yeah.
And this is going back, I think today more people might think to go to a counselor. And as time moves on, I think more and more people think to go to see a
Mm-hmm.
counselor. But I think in the past, it might just be like, I'm going to take care of this problem. I know I can go to AA or whatever. So within all of that, sort of context, I wonder if you
Yeah.
could talk a little bit about that path.
Um, So AA and NA, or Alcoholics Anonymous, Narcotics Anonymous, any of the anonymous groups, 12-step based recovery, are helpful and great for clients, right? There are certain people that flourish and find success in their recovery in those rooms. And those rooms have served a great purpose for a lot of people. And some, they are completely turned off and it's not for them. And so I guess it kind of goes back to just what I was saying earlier, in the sense of like, everyone is their own individual person. And so what works for you doesn't work for me. And, similar to people's recovery, what works with someone's recovery might work great for another, but not someone else's. And AA and NA are wonderful areas and environments and resources for people who have felt alone and isolated by their struggles.
Mm,
Um, you hear it as, it is a fellowship, and that is
mm,
very much what it is at its core, right? And it's a
yeah,
place for people to come and have something in common, right? And have support and an environment in which they are not judged for the things that they often carry as shame or guilt.
yeah.
Um, and so some people thrive in that. AA or 12-step recovery is not the only modality or the only place to find that. There's so many other support, mutual self-help support groups out there, in terms of just different views or understanding, connections. And so while AA and NA are probably the most that you're going to find out in the world, that have the most amount of meetings worldwide, you can go on a cruise and find a meeting. You can go to any continent and find a meeting. I think the fact of the accessibility in terms of virtual meetings has allowed for more accessibility for non 12 step based meetings to happen. You have online forums, Facebook groups, different websites, apps now that really allow for more connection and support for a substance free life, if that's what someone's
Mm.
wanting, or a harm reduction life, or looking for different connections. But I think the biggest part and the biggest benefit of all of this, and it goes kind of back to that notion that I mentioned earlier of the isolation. This is about connection. Like,
Right.
right, the opposite of dark is light. The opposite of isolation is connection, and um, that's really where we find a lot of that support and resource for folks.
Yeah, yeah, and I guess a positive of social media, or a positive of being able to go online, is you can find those groups of people and can connect with them, and
Yes.
know, like you're saying, know that they're out there,
Yeah.
so a person doesn't feel alone.
Yeah.
And I'm amazed, at how many of these groups there are and how often they meet.
Hmm.
um, and it in one respect, I think, oh wow, there are many more people out there with these issues than we all probably imagine
Hmm.
as that. And then, oh, it's great that there are these support systems out there for people like that. And you brought up a substance free life. I think if those were your words, and that brings me to, like, how difficult it is, because we live in a society that's pretty much everywhere you turn there's maybe an advertisement, or
Yeah.
just a liquor store, or now you walk down the street in New York City and you're just constantly smelling cannabis, right?
Hmm.
And so we're surrounded, and so it takes a lot of strength for a person to live in our society and not use, right? And if that's what they need to do,
Yeah.
because I've heard some stories. This one gentleman was saying he hadn't drank in 20 years. He retired. He thought he could have a drink at his retirement. He had a
Hmm.
drink, and it led to a 3 or 4 week binge.
Hmm.
He couldn't stop himself from drinking,
Yeah.
and health issues and everything. And you think how powerful that is. That one drink did that. Um,
Hmm.
and I think that's helpful for people to understand how difficult it is, if a person does have an issue, um, to make the right decisions and to live in our society where you're constantly tempted, and
Hmm.
constantly being triggered.
Yeah.
Um, so I wonder if you could talk a little bit about that, and any advice you have for people, any either you know dealing with that, or to help people understand more, like, that a person may be going through something that
Um. Okay. So I think um, w- one of the strongest things and most courageous things people can do is say, "I need help." Um, so seeking help is probably, I always tell clients, like, the really showing their strength and courage, um, to identify what your goals are. So I can tell you in terms of what, like, textbook and data and DSM and ICD and all of those, like, fun clinical stuff suggest, but, like, that's not real life all the
Mhm.
time. And again, individual, you are a person, you are your own being. And what works for you might not work for me, and similar in someone's recovery. And so defining that for what it is and what works for them. And so that really takes away this like black and white of what recovery should be, and really puts it into, you get to create that for yourself.
Mm.
And so for some folks, it's medicated assisted recovery, or medications to treat opiate use disorders, or medications to treat alcohol use disorders, or being on a mental health medication of sorts to help with anxiety or depression. It could be, I'm going to continue to use, but I'm not going to use uh, substances that I haven't used the fentanyl testing strip for, or
Mm.
things that I'm not going to use without having someone with me. And so, right, everyone's recovery and what that means to them is their own personal choice. Um, Obviously, our ultimate goal is for uh, and we hope that someone can live a substance-free life in terms of what that means, and that they're not continuing to use drugs that put them at risk. um, but it's all at their discretion or their decision. And so, again, giving them agency and autonomy to make that choice, and
Hmm.
supporting them without judgment. So I think that really goes to someone's recovery journey, and how they get there and what it means for them. And then I know there was a second part of your question, and I can't remember it because I
Yeah,
just.
it's kind of a rambling observation that led to a question. Um, yeah, I mean, I think that was very helpful. And it just was, like I said, I have this, it was this wonder about, like amazement at how difficult it is for a person, and it like living in our society where you're just constantly tempted and surrounded
Mhm.
by all these things that, you know, drink this, take that, and so it's very difficult.
Yeah, and now, like, thinking about it too, I'm thinking about even some clients that are like, I just don't want to have anxiety anymore, and it's like, well, we all don't want to have anxiety, but
Yeah.
we want to minimize that as much as possible, or have the tools to deal with it should you experience it. And I know, um, just thinking about some clients getting really frustrated in the fact that it's like, I've come so far, but I'm still experiencing it, or I still have moments of, and it's like, but
Mm-hmm.
that's a reminder that you're human, and it means that there's room for improvement, but look at how far you have come. And
Mm-hmm.
even just thinking back to that story that you shared of that person who was sober for 20 years, decided during his retirement he could have a drink. For some folks, recovery is a daily practice. It's
Yeah.
something that they need to make sure that they start their day every day with, how am I staying sober today? And real, the classic line that you'll hear in rehab or rehab, short term in treatment, is, if while you're doing push-ups in here, your addiction's doing push-ups outside. Like, it's just um, it's something that unfortunately can't just disappear from your life,
Yeah.
never to be thought about again, but
Yeah.
that's something that is to have moments of self check in. And is this um, a decision that I want to make, or a decision that I don't? But also that if someone does decide after 20 years to have a drink, that doesn't mean that they're throwing away their whole life, and all of that time that they might have had, or knowledge in recovery. It's something, maybe that's something that you shouldn't toy with. Um, and how can we make sure that if that thought pops up again, learning from this experience?
Yeah. Yeah. And as you were talking there, I think it was making me think that it is a daily management of something, and I think that's what led or leads people to believe, well, it's like an illness, and so that's like the illness model, but we've kind of moved away from that, right? So
Well, I think it's, you wouldn't tell someone who has diabetes that they don't need to take their insulin
Right.
or their medication or watch what they're eating, or just, and it might not be something that they have to do every day anymore, or something that they have continuous flare-ups, but it is something in the back of their mind where it's, if I don't take my medication for a certain amount of time, then I might be risking a flare up or having, my diabetes, like unmanaged diabetes.
Right.
Um, and so we have to almost take that same kind of thought and notion with mental health, with substance
Hmm.
use. And it's not that it's every day that's like this forefront of, I need, like, checking off that I took my medication or did my daily whatever, but it is something in terms of just being aware and knowing that you have to navigate life in that, with that as a thought. And I know for some people it's really frustrating because it's, well, can't you just stop and it be done and
Right.
over with and that's it?
Right.
No, we wish, but no.
Right.
And
Right.
unfortunately, it's not that easy or that solution, and it's not just this flipping of, a switch.
Right. Yeah, it is that understanding, and I think more and more people have it that, oh well, I drink or I drank or I tried this or I tried that, and I didn't develop a problem. Like why,
Mhm.
and you know, we kind of talk through all the reasons why that type of thinking isn't accurate. Um, so, is there anything I didn't ask or anything that you want to add at this point?
Um, the only thing I guess I would add is just, be kind to one another.
Yeah.
uh, um, know that there's a lot more going on underneath, and that,
Yeah.
like I said before, the opposite of dark is light. And we do walk around with a lot of baggage or shame and guilt about certain things. And that, just, if someone is reaching out to you and saying, I have a problem or I'm struggling with something, is to not have that initial visceral reaction of, but to how to be supportive. um if this is something that you think you would be good at, obviously it's like, think about maybe exploring a counseling or a degree or something. And so, a shameless plug of Montclair State University Department of Counseling. No.
Yeah.
um but that the need for licensed clinicians is needed. I
Yeah.
mean, we're seeing that in terms of just data. And if we are looking at the need for more credentialed clinicians to help, unfortunately, it is a field that there's people that need the help. And our ultimate goal within our field is to put ourselves out of business. But,
Yeah.
I think, just be kind.
Yeah.
We're all
That
human.
that definitely helps. That's a good approach. And we know the suicide hotline is 888 and um
988. Yeah.
988. Thank you. And are there any other sort of hotline type numbers or websites that you would recommend?
So in the state of New Jersey, you can call 211, and that's kind of like a resource for like housing, just a resource number, 988 for the National Suicide Hotline. If you are in need of like finding substance use treatment, SAMHSA, which is the Substance Abuse Mental Health Service Administration, so that's SAMHSA. They have a treatment locator to help you. Just type in your zip code and it'll bring up all of the treatment options around you. And then I wish I could, and if it's substance use related in the state of New Jersey, and I might get this wrong, but I think it's 1-844 REACH NJ. And that's to be connected to resources to help find a treatment locator should you need substance use treatment. Not to say that they wouldn't help with mental health as well, but it's substance use related.
Yep. Okay. Yeah. Thank you. And then people can find you, like Google you, or like just
Yeah, you can Google me. No. So you can find me on LinkedIn under just Lisa Ellis, my
okay.
maiden name, and you can find me some more information on my website, collaborative therapy services llc.com. That's a mouthful. Or also at Montclair State University website, you can look under the Department of Counseling. You can learn about all of our faculty members and our department as a whole. And
Okay.
yeah, those are some places.
I'll add some of that to the show notes. People, of
Yes.
course, can contact me, but there are a lot of different ways to reach you. Lisa, thank you so much
Yeah.
for
Thank
your
you,
time,
Jamie.
all this wonderful information,
It was a
and
lot of fun.
yeah, it was. I have 1,000 more questions, and I feel like maybe we'll do a part two
Yeah,
sometime, because
of course.
this is definitely a topic that's deep. We scratched the surface a little bit, I think, here. So
Yeah,
thank you.
just a very small scratch, but there's
Yeah.
a lot more. So,
Yeah.
yeah, thank you again.
Okay. Thanks everyone for watching and listening. We'll see you next time.